8 silent signs of magnesium deficiency that may affect your heart. Your blood test can only see about 1% of the magnesium in your body. 1%. The other 99% is locked inside your bones, your muscles, and your cells, where a routine test simply cannot reach it. Which means you can sit in your doctor's office, hear the words your results look normal, and still be walking around with a shortage your heart can feel. And that shortage is not rare. National dietary surveys suggest nearly half of all Americans do not get enough magnesium from food. Almost 1 out of every 2 people. Now, before we go further, one important note. This video is for education only, and it is not a substitute for advice from your own doctor. If anything here sounds familiar, that is a reason to start a conversation with a professional, not a reason to worry alone. So why does one mineral matter this much? Because magnesium takes part in more than 300 chemical reactions in the human body, and a surprising number of them happen inside your chest. Every heartbeat you have ever had depends on a precise electrical balance between magnesium, calcium, potassium, and sodium. Get that balance right, and the rhythm stays steady for decades without a single conscious thought from you. Let magnesium slip too low, and the whole system can start to wobble in ways that are easy to feel but very easy to misread. Here is what makes this so slippery. The warning signs almost never announce themselves. They arrive disguised as the ordinary complaints of a busy life, or worse, as the things we have all been taught to accept as simply part of getting older. Over the next few minutes, we are going to walk through 8 of them. A few will probably sound familiar right away. But one in particular, the sign we save for near the end, is mistaken for a completely different condition so often that people can spend years treating the wrong thing entirely. When we get there, I think it will change how you hear a symptom that millions of people brush off every single day. There is one more thing worth understanding before we start, because it explains how a shortfall this widespread could develop in a country with more food than any generation in history. Magnesium lives in whole foods: leafy greens, beans, nuts, seeds, unrefined grains. But when wheat is milled into white flour, most of that magnesium is stripped away in the process. When fresh vegetables give way to packaged snacks, the mineral quietly disappears from the plate. Add in the prescriptions many older adults take every morning, some of which increase magnesium loss or interfere with how much the body absorbs, and you have the conditions for a slow, invisible drain. No dramatic moment, no single day when something obviously goes wrong. Just a gradual decline that unfolds over years, one ordinary complaint at a time. Let us begin with the sign that tends to frighten people the most. Number 1, a fluttering, skipping, or racing heartbeat. Imagine sitting quietly on the couch in the evening and suddenly your heart does something strange. A flutter, a skipped beat, a brief racing sensation that passes before you can even react. Doctors call these palpitations, which is simply the medical word for being aware of your own heartbeat in an unusual way. Occasional palpitations are common and often harmless, but when they show up again and again, magnesium deserves a place on the list of possible explanations. Here is why. The electrical system of your heart works a little like the wiring in a house. Magnesium helps stabilize the electrical charge across the membranes of your heart cells, keeping the rhythm steady and predictable. When magnesium levels drop, those cells can become more excitable, a bit like a light switch that flickers when the wiring is loose. Research has linked low magnesium with certain irregular heart rhythms, including a condition called atrial fibrillation, which is a fast and disorganized rhythm in the upper chambers of the heart. In fact, in hospital settings, magnesium given through an intravenous line is sometimes used by doctors as part of the treatment for specific dangerous rhythm disturbances. That does not mean every flutter is caused by a mineral shortage. Palpitations can come from stress, caffeine, thyroid problems, anemia, and many other causes, some of which need prompt attention. So if you experience frequent palpitations, chest pain, fainting, or shortness of breath, do not wait and do not self-diagnose. Call your doctor, and if the symptoms are severe or sudden, call 911. But if your heart occasionally stumbles and your evaluations keep coming back normal, it may be worth asking your healthcare provider a simple question. Could my magnesium be part of this picture? That was the question that changed things for Walter, a 69-year-old retired electrician from Michigan. For nearly 2 years, he felt occasional flutters in his chest, usually in the evening after dinner. Every test came back reassuring. His heart monitor showed extra beats but nothing dangerous. It was only when a new physician looked at the whole picture, his long-term use of a water pill for blood pressure, his low appetite for vegetables, and his nightly leg cramps that magnesium entered the conversation. Walter's story is not proof of anything and every case is different, but it illustrates a truth worth holding onto. Sometimes the answer is not hiding in a more advanced test. Sometimes it is hiding in an ordinary question no one thought to ask. Now, from the heart itself, let us travel outward to the muscles you can actually see and feel, because they often speak up long before the heart does. Number 2, muscle cramps that strike without warning. Picture this, it is 2 in the morning. Harold, a 73-year-old retired mail carrier from Ohio, is sound asleep when his calf muscle suddenly seizes into a knot so tight it feels like stone. He grips the mattress, breathes through the pain, and waits for it to release. His wife tells him it is just part of getting older. But nighttime leg cramps like Harold's are one of the most classic complaints associated with low magnesium. Your muscles contract when calcium flows into the muscle cells, and they relax when magnesium helps usher that calcium back out. Think of calcium as the gas pedal and magnesium as the brake. When the brake fluid runs low, the muscle can get stuck in the contracted position, and that is the cramp you feel. The same mechanism may be behind those small, annoying twitches, like an eyelid that flutters on its own for days or a thumb that jumps unexpectedly. Now here is the connection that most people never make. Your heart is also a muscle. The very same chemistry that causes a calf to cramp at 2 in the morning is at work, in a more delicate form, inside the walls of your heart every second of your life. That is why doctors often view unexplained, recurring cramps not as a trivial nuisance, but as a possible window into your overall mineral status. Cramps can also come from dehydration, certain medications such as diuretics and circulation issues, so persistent cramping is always worth mentioning at your next appointment. It may be helpful to ask whether your medications, your diet, or your mineral levels could be playing a role. And speaking of things people blame on getting older, the next sign is probably the most dismissed symptom in all of medicine. Number 3, deep fatigue that sleep does not fix. Everyone gets tired. But there is a particular kind of tiredness that rest does not seem to touch, a heaviness that follows you from morning coffee to evening news, and that kind of fatigue may have a biochemical explanation. Every cell in your body runs on a molecule called adenosine triphosphate, usually shortened to ATP. You can think of it as the energy currency of life. Here is the detail that surprises most people. ATP is not biologically active on its own. To actually work, it must bind to magnesium. In a very real sense, your energy molecules need a magnesium partner before they can spend a single unit of power. When magnesium is scarce, your cells can struggle to produce and use energy efficiently, and you may feel it as a fog of exhaustion that no nap can clear. For your heart, this matters enormously because the heart is the hardest working muscle you own. It beats roughly 100,000 times every single day, without a coffee break, without a vacation, without a single moment of full rest. An organ with that workload is exquisitely sensitive to anything that interferes with energy production. Of course, ongoing fatigue has a long list of possible causes, from thyroid conditions and sleep apnea to depression, anemia, and heart disease itself. That is exactly why unexplained, persistent exhaustion deserves a proper medical evaluation rather than another energy drink. But as part of that conversation, magnesium status is a reasonable topic to raise, especially if fatigue travels together with some of the other signs on this list. There is one more layer here that researchers find fascinating. Physical activity itself increases the body's demand for magnesium because working muscles burn through energy faster and lose minerals through sweat. This creates an unfortunate irony. The very people trying hardest to strengthen their hearts through exercise may be quietly raising their magnesium needs at the same time. And if their diets do not keep pace, the fatigue they feel after workouts may be deeper and longer lasting than it should be. So if you have started a new walking routine or fitness program and feel wiped out in a way that seems out of proportion to the effort, that is not necessarily a sign to quit. It may simply be a signal that your body's supply lines deserve a review. So far we have talked about symptoms you can feel. The next sign is different. It is silent, it is measurable, and it may be quietly reshaping your cardiovascular future. Number 4, blood pressure that keeps creeping upward. High blood pressure has earned the nickname the silent killer for a simple reason. It usually causes no symptoms at all while it slowly stresses the heart, stiffens the arteries, and raises the risk of heart attack and stroke. What many people do not realize is that magnesium plays a quiet but meaningful role in keeping blood pressure where it belongs. Magnesium acts as a natural relaxant for the smooth muscle inside your blood vessel walls. When those muscles relax, the vessels widen slightly, and blood flows with less resistance, the way water moves more easily through a wide garden hose than a pinched one. When magnesium runs low, blood vessels may tighten and pressure can drift upward. Large analyses that pooled results from many clinical trials have suggested that magnesium supplementation may produce modest reductions in blood pressure, particularly in people who were low to begin with. The effect is not dramatic, and magnesium is absolutely not a replacement for prescribed blood pressure medication. Please never stop or adjust a prescription on your own. But researchers have also observed that people who consume more magnesium-rich foods tend, on average, to have lower rates of high blood pressure and cardiovascular disease over time. Consider Dorothy, a 68-year-old grandmother from Georgia whose readings kept inching higher year after year despite her efforts. When her doctor reviewed her diet, it turned out she was eating very few leafy greens, nuts, beans, or whole grains, the foods where magnesium naturally lives. Her situation is remarkably common. If your own numbers have been creeping upward, it may be worth discussing your overall diet, including magnesium intake, with your healthcare provider as one piece of a larger plan. Now, blood pressure is something a machine can measure. The next sign is stranger because it shows up as sensations that seem to come from nowhere. Number 5, tingling, numbness, or odd sensations in your hands and feet. Have you ever felt pins and needles in your fingertips when your hand was not asleep? A patch of numbness on your foot, a crawling or buzzing feeling on your skin with no visible cause. These sensations happen because your nerves, like your heart cells, are electrical structures, and magnesium helps regulate the flow of charged particles that nerves use to send their signals. When magnesium drops low enough, nerves can misfire, creating sensations that are not connected to anything actually touching you. In more pronounced deficiency, this can progress to muscle weakness or even more serious neurological symptoms, which is one reason severe magnesium deficiency is treated as a genuine medical problem in hospitals rather than a wellness footnote. Here is the thread that ties this back to your heart. The nerves that create tingling in your fingertips rely on the very same electrical chemistry as the specialized fibers that conduct each heartbeat through the walls of your heart. When the body's electrical environment becomes unstable, it rarely limits itself to one location. Now, an important word of caution. Tingling and numbness have many possible causes, including diabetes, vitamin B12 deficiency, nerve compression, and circulation problems, and some of these need timely treatment to prevent permanent damage. Sudden numbness, especially on one side of the body, can be a sign of stroke and is an emergency that requires calling 911 immediately. So please treat persistent or unusual sensations as a reason to see a professional, not as a puzzle to solve at home. Within that professional conversation, magnesium is simply one more reasonable suspect to consider. What makes these sensations so easy to ignore is that they usually come and go. A patch of numbness fades, the tingling passes. And because it disappears on its own, most people file it away as nothing. But your nervous system does not send those signals for no reason. Think of them less as a diagnosis and more as a message. Something in the body's electrical balance may be off, and the wise response is not panic, but curiosity paired with a professional opinion. At this point, you might be noticing a pattern. Magnesium keeps showing up wherever electricity and muscle meet. Which brings us to the hours when your body is supposed to be recovering, because low magnesium may be sabotaging those too. Number 6, restless nights and sleep that never feels deep. Sleep is when your cardiovascular system does its maintenance work. During deep sleep, heart rate slows, blood pressure dips, and the whole system gets a nightly tune-up. Researchers have found that people who consistently miss out on that nightly dip tend to face higher cardiovascular risk over the years. And magnesium appears to be one of the quiet players behind good sleep. It supports the activity of a calming brain chemical called GABA, which helps your nervous system downshift from the alert mode of the day into the relaxed mode of the night. Magnesium also appears to interact with melatonin, the hormone that helps set your internal clock. When magnesium runs low, Some people find themselves lying in bed with a tired body and a wired mind, or waking at 3 in the morning for no reason they can name, or being jolted by restless, twitchy legs just as they drift off. Over weeks and months, that kind of broken sleep does not just make you miserable. It deprives your heart of the low-pressure, slow-rhythm recovery period it was designed to receive every night. Some studies in older adults have suggested that magnesium supplementation may modestly improve sleep quality, though scientists are careful to note that the research is still developing and results vary from person to person. Margaret, a 71-year-old widow from Texas, described her nights this way. She said her body would lie down, but her mind refused to follow, as if a switch somewhere inside her simply would not flip. She had blamed grief, then age, then the neighbor's dog. Her doctor took her sleeplessness seriously, screened her for other conditions, and along the way discovered her diet had narrowed dramatically since she began cooking for one, with almost none of the magnesium-rich foods she used to prepare for her family. Her experience is a reminder that sleep problems are rarely about just one thing, but nutrition is a thread worth pulling. If your nights have quietly fallen apart, it is worth bringing that up with your doctor as a health issue in its own right, and worth asking whether your mineral intake could be one of the contributing threads. And that restless, wired feeling at night leads us straight into the next sign, because for many people it does not stop when the sun comes up. Number 7, a constant undercurrent of anxiety and edginess. This is the sign I hinted at near the beginning, the one so often mistaken for a completely different problem. Countless people live with a low-grade hum of anxiety, a sense of being keyed up, irritable, or on edge for no clear reason, and they naturally assume the cause is purely psychological. Stress at work, worry about family, just a nervous personality. And sometimes that is exactly what it is, but here is what fewer people know. Magnesium helps regulate the body's main stress response system. The network scientists call the hypothalamic pituitary adrenal axis, which is essentially the chain of command that decides when to release stress hormones like cortisol. Magnesium also acts as a gatekeeper on certain brain receptors involved in excitation, helping to keep the nervous system from becoming overstimulated. When magnesium is low, that gatekeeping weakens, and the stress system can become trigger-happy. The result can feel like anxiety that arrives without a story attached to it. What makes this especially cruel is the vicious circle hiding underneath. Stress hormones cause the body to lose more magnesium through the urine, and lower magnesium then makes the stress response even easier to trigger. Stress drains magnesium, and low magnesium amplifies stress. Round and round it goes. For your heart, this loop matters, because chronic anxiety and elevated stress hormones are associated with higher heart rate, higher blood pressure, and greater long-term cardiovascular strain. To be absolutely clear, anxiety disorders are real medical conditions that deserve proper care, and no one should replace therapy or prescribed treatment with a mineral. But if you have felt inexplicably wired for months, it is entirely reasonable to ask your healthcare provider whether nutritional factors, including magnesium, might be part of your story. That leaves one final sign, and it is the one that pounds on the door until you pay attention. Number 8, frequent headaches and migraines. If you have ever had a migraine, you know it is not just a headache. It is a neurological storm, sometimes with throbbing pain, nausea, and a strange sensitivity to light and sound. What does that have to do with magnesium and your heart? More than you might think. Researchers have repeatedly observed that people who suffer from migraines tend to have lower magnesium levels than people who do not. The proposed reasons involve the same themes we have seen all video long. Low magnesium may make nerves more excitable, may affect the release of certain brain chemicals, and may influence how blood vessels in the head constrict and relax. The evidence has grown strong enough that some major headache organizations list magnesium among the supplements that may help prevent migraines in certain people, always under medical guidance. Consider Alina, a 66-year-old retired schoolteacher from Pennsylvania who battled migraines for most of her adult life. During a routine visit, her doctor reviewed her long-term use of an acid-reducing medication, a type of drug called a proton pump inhibitor, which over many years may reduce magnesium absorption in some people. That conversation opened a door Alina never knew existed. Her story highlights something worth remembering. Common medications, including certain acid reducers and diuretics, along with heavy alcohol use, poorly controlled diabetes, and digestive conditions that impair absorption can all quietly drain magnesium over time. Frequent headaches always deserve a proper evaluation because they can occasionally signal serious conditions. A sudden, explosive, worst headache of your life is an emergency, and the right response is to call 911. But for the everyday pattern of recurring headaches or migraines, asking your doctor about magnesium is a fair and evidence-informed question. Magnesium is not a miracle cure, and low magnesium is not the explanation for every symptom on this list. Palpitations, cramps, fatigue, rising blood pressure, tingling, poor sleep, anxiety, and headaches each have many possible causes, and several of them can point to conditions that need real medical treatment. That is why the message of this video is not to diagnose yourself, and it is certainly not to rush out and swallow handfuls of supplements, because too much magnesium from pills can cause problems of its own, especially for people with kidney disease. The message is simpler and more powerful. Pay attention to patterns. One of these signs alone may mean very little. Several of them together, persisting over time, may be your body's way of asking for a closer look. And remember the number we started with, because it is the single most important idea in this entire video. A standard blood test sees only about 1% of the magnesium in your body. 1%. Pair that with the finding that nearly half of all Americans fall short of their magnesium needs, and you understand the real problem here. This is not a rare condition. It is a common one that happens to be very good at hiding. The encouraging news is that for most people, the answer begins in the kitchen, not the pharmacy. Leafy greens like spinach, nuts, and seeds, especially pumpkin seeds and almonds, beans and lentils, whole grains, avocados, and yes, even a modest square of dark chocolate are all naturally rich in magnesium. Building meals around foods like these is a gentle, safe first step that pairs well with whatever plan you and your doctor create together. And there is something quietly hopeful in that. Unlike many health concerns that require complicated interventions, this is one where small, everyday choices can genuinely move the needle. A handful of almonds instead of chips, a side of spinach at dinner, a switch from white bread to whole grain. None of it is dramatic, and that is exactly the point. The most meaningful changes for your heart are often the ones so ordinary that you barely notice you are making them. Before you go, I would love to hear from you. Which of these 8 signs surprised you the most, and have you ever experienced one of them without knowing magnesium might be involved? Share your story in the comments below because your experience might be exactly what another viewer needs to read today. If someone you care about, a parent, a friend, a spouse, tends to brush off symptoms like these, consider sending them this video. It might start a conversation that matters. And if you found this helpful and want more clear, honest explorations of how your body really works, subscribing means you will not miss what we uncover next. Take care of that remarkable heart of yours. It has been beating for you since before you were born, and it deserves a little attention in return.